Welcome to the Rotunda, the longest-running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out, come on.
Events to be remembered and retold for generations to come.
Well done, you're okay. Your baby's nearly here. Oh, here we go.
A baby being born, to say that you're part of that, something so life-changing for a couple is just amazing. And that's why I'm here. You just like to think that you've done your bit in relation to the fantastic day that they'll be celebrating for the rest of their life. It's brilliant.
On the delivery suite, midwives Ellie and Daryl are looking after Dublin teenagers Kaylee and Owen, who are expecting their first baby.
Since I got pregnant, I don't think I've bought myself much stuff for leggings and that. Because anytime I go in, I'm like, come on, we go down to the baby stuff.
Oh, the stuff is gorgeous.
Yeah, it's so hard.
That's why I hate going into Penny. She's like, I just need to go in and get knickers and socks. I say, yeah, right.
It's never knickers and
Best
socks.
baby girls.
How long are you together?
Just over a year.
I only need to get her 4 months when I got pregnant. Sure, no, doesn't matter.
No holiday, baby.
Yeah, he was made in Bulgaria.
I've 5 sisters and a brother. And there's 3 younger than me. And my nephew, and there's just always been babies in my family. So I knew I would be all right. We all work in here and crying.
I know.
I just love having kids around.
Slowly blow it out.
The contractions were, I don't actually think that it's a pain I'd ever forget. It was just like all around my waist, down to like nearly above my knees was just tightening. Every contraction gets worse. Yeah. It's awful.
Great.
I was in labour for 3 hours without an epidural because I was trying to like let it go as long as I could, but then it got to the point and even the midwife said to me, she said, yeah, I don't even blame you. Like I was like, no, I needed it, like.
Oh, this is not nice.
Oh, I'll do it next time, okay?
Just the next time. Never again.
No.
We'll see. No, actually.
Kaylee has chosen to get an epidural to help with the contractions. It's tough going for Owen.
Needles. Like every time you should get the epidural or whatever, I'd have to turn my head or I just don't do needles.
Okay, put the head
It's
up.
okay, you can move now
A
again.
little bit of coffee there, are you?
No, it's fine, asleep.
Well done.
If I was to get one, it would be kind of somewhere a little bit. My friend has a Chinese symbol just there, and it just means friend. Well, that's what your mom told her. It says it means it could mean like fanny. I don't know what it means. Nature.
Alan and Lorraine are expecting their second child today. They already have a boy at home and are hoping the omens are good for a girl.
Yeah, just the balloon that from the last baby went up. There's a pink balloon, so it might be a sign of a girl.
I didn't really have a first impression of Alan, if I'm totally honest. It took a few dates, basically. He won me over in the end. So, yeah.
She didn't fancy me at the start. She hates when I say that.
So, I mean, of course I fancy him now. Like, I married him.
While Lorraine and Alan are expecting their second child today, Lorraine is well used to hospitals. She has been in and out of them since she was a little girl.
My kidneys had never grown from birth. They didn't find this out till I was 9. So when I went to my GP, I was very sick. And he didn't know, basically, how I was still alive. We know by the time I got into Chapel Street, I was in ICU that night for 3 weeks. So, yeah, it just kind of went from there, like, you know. I started doing dialysis in Chapel Street, and my mum and dad then took the dialysis machine home. And they did it every night at home.
the age of 10, Lorraine received a donor kidney and underwent a successful transplant.
As a child, I wrote a letter then to the donor's family to say that I was so thankful and to give me the second chance of life. The lifespan, I think they say, of a transplant is 10 years. I have mine 24 years. So for that, let's hope that it still continues to go for another 24. You know, maybe double that until such time that, you know, I'm here and I have to leave, you know, that my kidney comes with me.
Pregnancy and childbirth can be high risk for those who have undergone organ transplantation, but Lorraine and Alan were determined to have another baby.
So we'll be getting you in shortly now, and we'll be extra cautious about bleeding just because the blood count is at slightly lower level, your hemoglobin.
Okay.
While you might offer recommendations to a patient, I feel that it's not up to me to tell a woman how many babies she can or should have. At the end of the day, that's the couple's choice, no matter how high risk they are. You know, some women you can counsel and they might have up to 30, 40, 50% risk of mortality in pregnancy, but yet it's their choice. I'll just support them and do what I can and hopefully have a good outcome.
Lorraine is about to go to theatre to have her second child. When she first met Alan, she was worried that she couldn't have kids at all.
Obviously, I wanted it just as much, but when you love somebody so much that you just hope that you could be that person to give them what they want to. He was always so supportive, you know, and always so reassuring.
Where are you going with, boy or girl? All this blue might be a boy. I think we were with each other about 4 or 5 years at the time. And she said, look, if it's going to be an issue about kids down the line, where do you stand? It's like, it's not going to make much difference. Like, I'm not going to go anywhere. I said, look, we'll play it by ear. It's amazing, isn't it? Take a baby out, you like.
Usually, if you're doing a cesarean section, you're nowhere near the kidneys. However, in transplanted kidneys, and in Lorraine's case, it is transplanted onto the right side of her abdomen. So it could actually be whenever you could palpate it during pregnancy, you could feel it. You could feel the kidney under her skin. And so therefore, it was quite near the area that we would usually go through if you're doing a regular cesarean section. So in order to avoid damaging the kidney or going anywhere near the kidney, you make an up and down incision.
Just kind of there to there, really. Yeah.
I would never have been able to have a natural delivery. The weight of the baby and the pushing at the end would have put too much pressure on the kidney.
Yeah. Seems to be okay. Is it happy with it?
Yeah, I think so. We should be okay.
Let's go. Yeah.
Oh. There we go. Hello, baby. Oh.
The doctor beside us, he was
Brilliant,
cool, wasn't he? Yeah, he just, so what's the guesses, he said, and I was just joking. I says, well, I ordered a girl, so it should be a girl, you know, and Lorraine was like, stop.
That's right. Hello. Hello. Baby. Leg cord tapping.
I won't look until you can see.
In that moment, you can't believe you've made this little person.
You were so shocked that you didn't even know if it was a boy or a girl, didn't you?
Yeah, I was kind of looking going.
She had to take her away straight away, so Lorraine turned to me, she goes, is it a boy or a girl? I said, it's a girl. Yes. I told you it was a girl. Just like the first time with James, yeah, you just feel so blessed, yeah. See, she's perfect.
Is that okay? It's perfect.
Yeah, we just have to figure out what we're going to call you.
never know, there could be a fourth generation working here.
Not yet.
No, not yet.
Not for a long time.
When I started in '84, there was all foreign students. They'd come in September and they'd live in until March. They had this small room, they had to eat and sleep and look after themselves, which they weren't used to. There was one of the girls, she was 26, and it was her first time to wash her own hair. And she asked me, could I help, you know? It was
So you're hairdresser as well.
Where are you from?
I'm from Clare.
We seen a thing on Facebook last night and I was like, does anyone actually know anyone from County Clare? Because I'm starting to think it's not a real place.
Well, you met the best one. Am I okay to go ahead? Yep, that's all right.
Ellie is checking how far dilated Kaylee is after 4 hours on the delivery suite.
At the minute, it's just about 2 fingers, so just about the top of your 2 fingers, so about 1 to 2 centimetres, but it's paper thin.
Still a long way to go.
No. It might get quicker, hopefully.
You never know.
Two hours later, Kaylee is hoping that her labour has progressed.
It's probably kind of more or less the same as what it had been.
Oh.
But the baby's head has come down a good bit.
To let time pass, it was just dragging in. Felt like I was there my whole life.
I'm gonna be here all night, aren't I?
It's just frustrating because you've already had well over 24 hours of being here and after your water's breaking and everything.
To try to move her labour on towards her preferred natural delivery, Kaylee has been put on an oxytocin drip.
Is that okay? With that drip, there's only so much of it you can have. Like, we can't keep flooding your body with it if it's not doing what we want it to do. But at the minute, there's nothing set in stone that it's going to be a section or anything like that. But just
It's like there's a course in my family of having to be sectioned because my mum had 2 and me and my sister. My sister had twins and she hadn't, and they're all emergency sections. So it was like I was waiting, like I just had a feeling the whole time, like I'm gonna have to be sectioned. Like I wanted to break that course in my family.
Yeah, I'm just scared.
It's perfectly fine, babe. Lucas, you're doing great. You're doing great, babe.
when we were looking at the tracing of the baby's heart, there was little kind of decelerations, which is like a little dip in the baby's heart, is what we call them. But the progression that we'd expect wasn't there. So I think as I was leaving, there was talk that maybe in another 2 hours, if things hadn't changed, that she would possibly be for a caesarean section at that time.
Hello in the house.
Look, it is.
Hi, Sean. Hello, how are you doing?
How are you?
Good evening.
Are you coming in here now?
Huh?
Are you
I
coming
am
in
indeed,
here?
yeah.
I was told that I'd be blessed if I get my midwife, so.
Oh, look at you there.
You do the short straw. So you're saying there now you say it?
No.
No, you'll be delighted with.
I went about the business with Ellie of finding out exactly what has been going on in this labour so that I'm up to speed and know where we are.
Like, she's kind of looking at a section at that point, I suppose, because she is contracting. Then she discussed...
That's what he said.
Told to take him out the sunroof.
I'm sorry.
With Lorraine still in theatre, Alan is taking in his baby daughter, only minutes old.
Just surprised because I kept saying it's going to be a girl, it's going to be a girl, you know, and then it's a girl, so surprised I was right. Well, I was warned by Lorraine's mum, Mary, ring me first. So as soon as Lorraine went into recovery, I rang Mary and she answered the phone straight away. And I says, well, what's the guesses? And she just said, no, just tell me. Baby girl. I rang my mum and she hadn't a clue. She didn't know anything was going on. I think we told her we were just in for bloods or something like that, and we weren't going back in till the following week. Yeah.
You know I won't be here this Sunday.
I know. I'm holding my little daughter here.
What?
I'm holding my little daughter here. I'm holding my little daughter.
You're messing
I swear to God.
Alan, you're messing.
I'm not messing.
There's not a day that goes by that I don't think of my donor. There's not one day. And their family, especially their family. If it wasn't for my donor, I wouldn't be sitting here today and have 2 beautiful kids and a husband.
We don't want to take any more risks. And we had James, and we're being very lucky to have Lara, and I think
that's it.
We're happy now just to have the 2.
Very happy.
Ah, she's perfect. As you would say, Matt, if you bake the cake, that's the way you'd want it to come out.
If you bake the cake, that's the way you want it to come out.
Yeah. Cheers, bye-bye. She's going to kill me.
In room 9, midwife Sean is getting to know Kaylee and Owen.
Who are Liverpool playing tomorrow?
We're playing West Ham Monday night.
Monday night, okay. Just hope he doesn't grow up now. He'll be a Leeds fan or...
Yeah, right. Born a red, live a red, die a red.
Tottenham Hotspur. Don't tell him.
We were just sitting there and talking about anything, and like it occupies you a lot, like your mind, just talking. And
it got to a stage where he was laying on the bed, sitting down, just holding that hand, talking to her, just reassuring her.
How old was he? Did he have
70.
70? Okay.
But he had said when he got cancer that he wanted to be home for his 70th and he wanted to be still here for Christmas.
Yeah.
And he was, so...
But he was surrounded by family.
Yeah.
Do you know, you can't ask for anything better than that.
No.
Really, you can't.
Like, we were all there when he took his last breath, so it was...
Okay. That's a lovely thing.
Yeah. And he was like, we'll make a deal. Said what he said, I'll try my best to get home from here.
Yeah.
So I can see the baby. But he was too sick, like, to hold on for it like that.
Yeah. Anyway, you can look from the other side.
Yeah.
I'll be back in one moment.
Yeah.
He's loaded, isn't he?
Yeah.
It's now 12 hours since Kaylee and Owen first entered the delivery suite, and finally it seems like things are progressing well.
they checked and I was 6 centimetres, and then it was just a little while later and I was 10 centimetres because it happened so slow, but then went so quick.
That's the one. Yeah, that's the push. Keep going, keep going, keep going, keep going with that push. You have this baby on the move.
I don't think I can do this.
I think you can. Honestly, I think you can.
I know you can.
How are we doing? You all right, Kayla?
I'm not moving.
Hold it and chin forward, like I said, and that's it. Right into your bottom. Come on, keep going, keep going, keep going.
That's it, that's it, that's it, that's it, that's it, that's
Come
it.
on.
Could you just come out?
Okay, yeah, he will come out, he will.
He was like, no, come on, you're nearly there. But I knew myself that I wasn't. Like, I could feel it, but I knew that he wasn't coming out, like.
I'm going to ask Catherine, one of the doctors, to come in and see. It's just that baby is getting tired after a contraction. From a safety point of view, we can't let this continue for a long period of time.
Oh, it's just to help him get out.
Someone told to happen to him.
Baby, I can't do it.
I know.
Don't get upset, Kaylee. Come on.
My back is so sore.
Listen, you are almost to the end.
Apparently the Rotunda is haunted. There's a myth going around about Sister Sarah. One night, the bell went off. There was no one in the room, and I was like, right, Joe, just, be brave here now and just go around. And I went around all of the bedsides just to check on the women, to make sure they were okay, and to check on the babies. And I do remember at that time, there was one baby that was blue. Mum was asleep, and the baby wasn't crying, it was just choking, it was going blue. And I feel like that was Sister Sarah, telling me to just keep an eye, and it saved the baby. So maybe Sister Sarah is true.
Fire it, man.
Baby, I can't do it.
You can, I believe. I believe you can.
In room 9, Kaylee has been pushing for nearly an hour, and she's finding it hard to cope.
If things aren't going well, that's why the medics are there. They come in and we work together to get a delivery. In this particular case, it happened to be a Kiwi vacuum delivery. Okay, come on, here we go. I can feel it now in my fingers. Big deep breath. Hold it and big push into your bottom. That's it. Keep going, keep going, keep going. Here we go.
That once they start suctioning the baby, I only had to push about 3 or 4 times or something, and then he was born.
That was good push, Kaylee.
Oh, she was just short of putting her foot on the edge of the bed and pulling them out.
Here he comes. Push, that's it. Well done, well done.
A little push, a little push, a little push, a little push, a little push.
Well, there you go.
Look down, Kayla. That's it, you. Well done.
Well done, baby.
Congratulations.
Hello, Harley.
Why is he not crying? Why is he not crying?
No, that's all normal. That's all normal. He's not ready to cry.
We only had 2 seconds out.
Now we bring him over to the baby doctor, okay?
Please say so. He's had to open his eye.
He's fine. Hello, baby.
Please cry. Please cry.
He's fine.
Once we heard him crying, it was just like the whole weight just lifted off my shoulders.
Because of the way things went, because his heart rate kept dropping when I was actually in labour, he just started screaming, and it was great because it was great to actually hear his little cry. That's all I wanted to hear.
From a distance, I can do that from here. Let's get you over to your mammy. That's the main thing. Over there to your mammy, because that's where you need to be, Mr. Man.
So early, babe.
Now. You need to be against your skin on skin.
He was so different to what I thought he was going to be. Like, he had dark hair when he came out, and it was just mad, but I just loved him when I saw him. It was the best moment of my life. It's kind of in my head, like, someone depends on me now. So that's what, like, kind of makes you grow up. But
Hey, little man. We're not kids anymore, like, you have a responsibility. We're parents. It's daddy.
I love knowing that, like, someone is going to depend on me. Like, I hope he loves me as much as I love my mum. Like, I hope it is like that when I'm older, and that he can talk to me like the way I talk with my mum and all that. Yeah.
We'll give your poor mummy's heart broken over there. You're already a little gurrier, aren't you? What's this place? This isn't where you used to live, is it?
If he turns around and tells you he's poached anyone else other than Liverpool out of the house.
And it was meant to be that we were put in this room as well, look. D9, Dublin 9. You're a true Ballymunna, son. You're a true Ballymunna. It's okay.
This patient, I was giving out the bottles on postnatal, and she came up to me and she's like, "You wouldn't give us another bottle there, would you?" And I was like, "Oh yeah, I'll be around now with the bottles." And she was like, "No," she says, "me fella can't read, and he thought that the Aptamel was an Actimel, and he's after drinking it there." I was like, "All right, yeah, I'll get you the bottle." I was just like, "Oh, it's an easy mistake."
This baby's moving around very well. There's lots of...
In fetal assessment, parents of 2, Samantha and Anto, are in for a 20-week scan. They're expecting identical twin boys.
On the first scan, I thought she was after flipping the screen because the baby's head was from the left and the body to the right. But then that part of the screen went off, and then we seen the baby's head on the right and the body to the left, and I'm like, am I seeing things here? But then she's like, I think you have 2 in here. And all me and him kept doing was laughing, didn't we?
Yeah, it was great.
But we were delighted.
Samantha has been transferred from the Coombe Hospital in Dublin for treatment in the Rotunda because her babies suffer from a rare and dangerous condition called twin-to-twin transfusion syndrome.
Here. You can see the umbilical cord again here. This larger baby's getting too much blood supply, and he's going to get into trouble with heart failure if we let this go on.
Okay.
And this smaller baby over here is not thriving.
In about 20% of cases of identical twins, one baby gets too much blood and the other baby gets too little. This results in one baby getting into trouble because of heart failure and eventually dying, while the other baby gets into trouble by not thriving, by failing to grow because the baby's not getting enough blood.
The treatment for this is to put a camera in through your abdomen, around over here. It's going to come into the amniotic fluid sac here, and we're going to look at the placenta here, and we're going to find all of the blood vessels that connect the two umbilical cords together, and we're going to seal off those blood vessels so that there's no way for blood to get from the smaller fella over to the larger fella. Unfortunately, in a small number of cases, putting a camera into the abdomen in here may cause the waters, the membranes to rupture. And unfortunately, if the membranes rupture at 19 weeks, most people end up losing the pregnancy, a miscarriage.
We did say to the doctors, just be blunt with us and tell us out straight, because we want to know what to expect, even though you don't really want to hear it.
If we do nothing about this, in up to 90% of cases, the babies will die.
Okay.
So I think doing nothing isn't really an option for us. And we'll get the surgery done this afternoon.
Okay, thank you.
Okay?
Okay, thanks.
Any other questions?
It was clear that her twin-to-twin transfusion syndrome was already well established and was very serious, in fact life-threatening. For that reason, we brought Samantha directly to the operating room to perform the surgery.
Now let's do our laser fibre, yep.
Fetal surgery in the womb for twin-to-twin transfusion syndrome is a highly specialised procedure that's only done in a small number of hospitals around the world.
Now we have up here. Now again.
A tiny fetoscope, a camera, is placed through the mother's abdomen into the uterus and allows us to look up close at the blood vessels in the placenta. When we use this tiny camera, which is only 2 millimeters thick, we track all of the blood vessels throughout the placenta and find the vessels that are sharing blood between the two babies.
And yeah, and the vascular equator is probably going to be over here. So like, for example, there. Well, actually, no, it goes back. You see, look, it starts there and then it comes back in anastomosis to there. So that's probably okay. I think we'll just start where we can see. So laser on, please.
And using laser surgery, we seal off those individual blood vessels. It's important, though, to only seal off the right blood vessels, because if you close blood vessels that are contributing to the baby's health and well-being, unfortunately, the baby will die.
I just don't think I could go through the pain of losing a child. You know, and then if one did survive, then what would they be going through? Because they say with identical twins, they'd feel that there's something missing with the other.
So I need to bring the plane along there to join there to there.
Putting a camera through the uterus and the amniotic membranes might result in rupture of the membranes. And if this is going to happen, it typically happens within a couple of days of the procedure. So we need to monitor the mother very carefully in the days afterwards.
Hello, delivery. Samira, you know the lady that came up to the annex from Kaylee, the previous section?
Up and moving around the delivery suite, trying to help her labour progress, is Zosia, originally from Poland, and her Irish fiancé Dermot, who are expecting their first baby.
I wanted to go as natural as possible. Women have been given birth since, so it's natural for women, you know. They didn't have pain reliefs back then, or
I think for first-time mums, they have no idea what labour is going to be like, and I think for them, they probably think it might go one way. It's nice for them to have an idea, I think, and like a plan to follow. But
I
then
suppose it's not a plan.
Yeah.
You want to try sit on it?
It's cold. I want something on it first.
Yeah, I'll get
It's a sheet or something. Sit on that for a bit.
Quick, hot water bottle. Push on my back with your knee. Why are you pushing? I don't feel anything.
I'm pushing, don't worry. I was kind of watching and trying to help even. So.
Do you have strength today?
Yeah.
Yeah? Where is it?
It's going into your back.
I don't feel
He
it.
doesn't want to push you over. She was kind of vocal from the outset about what she wanted and what she didn't want. You can sit down if you want.
That might actually help you and me.
A little bossy, maybe.
Still need more pressure.
What way do you want to sit in the bed,
I'll be on my knees.
On your knees,
on your
no
knees.
problem. She wanted to change positions to help the labour move along, and it is shown to benefit that. So that's, you know, really, really good to do.
Oh, my back is really sore.
We'll get the hot water bottle back for you.
Oh.
Just lower down, is it? Here.
Nobody could apply enough pressure for me, like, even you, the midwives. I wasn't happy, like. I think I'm gonna sit back where I was the first time.
Background, like in the bed? Yeah, no problem.
Oh, it's just, you know, just like kind of cooling down, you know? This is annoying me because it's falling off.
I'm gonna have to put that behind your head there. Sorry. Now. Okay. Yeah. I mean, whatever goes, like.
Oh, it went.
It's not gonna stay.
Worth a try.
I think I was a bossy bitch. At some stage. Not all the time.
Kayla is checking how far Zosia is dilated since her last examination 2 hours ago.
Zosia, you're still 3.
Yeah.
Okay. So, because you're the same as you were last time, we just have to let the doctors know, all right?
Okay.
And because you're still 3, they normally like to start an oxytocin drip to give the contractions a bit more oomph behind them, all right, to get things going, okay? How do you feel about that?
I wasn't keen on the oxytocin because when you start having interventions, then in my mind it was like, okay, we'll do one, then the next one, then we'll end up with that. You know, I didn't want that. So I just wanted to go as natural as possible.
C2G is normal, it's lovely. Her obs are perfect. I've re-examined her and she is still 3 centimetres and she's not keen for oxytocin.
I'm not. I'm going to go. I've had my.
Sorry, Zosia. So I spoke to one of the doctors, all right? They're happy enough, I think, to give you 2 hours. We can reassess then. Now I'm going to relax the bed back, okay?
Then I need this out of my back because
There's a hot water.
In labour, it's hoped that mothers will dilate by about 1 centimetre per hour. 4 hours ago, Zosia had reached 3 centimetres.
Zosia, you're about 4. So, Zosia, since 10:15, that's 4 hours, you've made 1 centimetre. All right. How do you feel about the oxytocin drip now? To get things going.
I still don't want it.
You still don't want it? Okay. I do have to inform the doctors, all right?
Okay. I hate hospitals. Like, I don't like the beds, the machines, the lights, everything is like... So I think that's why I'm kind of slowed down with the contractions, because I wasn't at home.
She was the same last time. I rang Mohammed. He said give her another 2 hours because she didn't want oxytocin. She is now 4 and she still doesn't want oxytocin.
Zosia is sticking firmly to her birthing preference of having no medical intervention, including the hormone oxytocin, which stimulates labour. However, over the next 2 hours, very little progress is made.
So we're still 4, okay? How do you feel about the oxytocin now?
It's up to you. It's your choice.
I suppose, Zosia, like, ultimately, we want you to have a normal delivery. But if you're not getting closer to 10, the likelihood of that happening is not very high, okay?
It was kind of weighing up, you know, yeah, I know, Zosia, that you don't want oxytocin, but oxytocin might get you a normal delivery. Whereas, you know, no oxytocin might get you a cesarean section.
I don't know.
I know. Look,
I feel like I'm giving up.
Don't be giving up. You can't give up. You've no choice. You're in the middle of it.
Push my back.
I think you'll be good whatever decision you make. So I'm sure.
No, just push it, don't circle it, honey.
Oh, I still have tea bags in my pocket. Sniff.
I can actually smell them from here. Like, they smell amazing. Pocket potpourri. Pocket potpourri.
It's the day after the twin-to-twin transfusion treatment, and Samantha is being scanned to see if her identical twins survive the night.
Sometimes when you seal off the blood vessels on the placenta, there's not enough blood supply in the placenta left for one baby. So it's possible that one baby's heartbeat may stop. That can be a particularly nerve-wracking time for the family to wait to see what are the heartbeats like. So that's the first baby. That's the baby who was getting too much fluid. He looks very strong, very good, strong heartbeat there. There's the second baby who was getting too little. Yeah, so it looks very good. Yeah, so certainly they both sound very, very good. When we looked on the ultrasound, you could see both babies moving around vigorously, both heartbeats very strong. So let's see what the fluid is like. So already you can tell that there's not nearly as much fluid around the larger baby, so that looks good. The placenta is much bigger, so there's less pressure on the placenta. So I think if we now just have a little bit of luck on our side and we run into no troubles in the next week or so, I would be very optimistic that things are going to go well for you. But obviously, we're still on early days, we'll see how things go. So, but it looks good, so we're very happy with it.
Thanks very much.
All right, okay. I'm delighted to be all right.
Thank you.
All right, okay. Well done. Okay, Samantha. All right. Because a small percentage of patients who have twin-to-twin transfusion syndrome and have surgery for that condition will have a recurrence of the problem, they still need to be watched very carefully with scans every couple of weeks until the time of delivery. And hopefully over the coming months, Samantha will get up as far as potentially 34 weeks gestation before having a planned delivery.
Still a bit to go.
I'm 22 weeks pregnant now, and we still have that little bit of fear, but not as bad. And now we're just more excited now. Thanks very much. Thanks a lot.
I know you're wrecked, but you've done amazing work up to now. You have it in you. You've got to 4 on your own steam. And you might only need a small amount of oxytocin. You know, that's honestly, it's much better that you're in labour and getting a bit than us having to put you into labour with it. So you've done incredible work.
I was kind of thinking, like, we're here for hours, like, you're tired. If we keep going for hours longer and nothing's happening, then there's probably going to be more intervention needed later. So, and I knew they were worried about the baby's heart rate.
I know.
All right, and don't doubt
I'm
yourself.
Just stressed
I know.
that I won't be able to cope because.
After 8 grueling hours, Zosia has decided to go on the oxytocin drip to try to progress her labour.
I had the option. They didn't say, oh, you have to have it now, or, you know, yeah, like they offered it twice and we waited 2 hours, then another 2 hours. And then I decided, okay, let's have it, yeah. I just went with it.
Usually, like, women they don't like bright lights when they're labouring. So as kind of things moved along, the blinds came down, all the lights were turned off.
I don't think they're going to help, though.
The sunglasses was something I have heard of once before but never seen. Yeah.
It was very funny just watching you in the delivery room with the sunglasses
I
on,
didn't
your
care.
headphones on, and you were just in your own little world.
It's now just 2 hours since Zosia went on the drip to increase the intensity of her contractions.
You're 9.
Oh gosh.
Yeah, you're flying it. My manager, no. Where was you saying you weren't 10?
Yeah.
Yes.
Good woman. Oh, 9.
It really kicked in quickly, like, and you could see your contractions were stronger, and they were very,
they were stronger.
Can I take this off?
Which?
Way
I think
too
I took
warm.
everything off.
Yeah.
I was just in my own world, really. I didn't even know what you were talking about. Were you talking about something? I don't know.
Very close.
Can I go?
Do you want to go out?
Up and down, eh? You felt like she was coming.
I
and you
just
really
wanted
weren't
to change position
Yeah.
because, the movement will help, obviously, and gravity will help. So I wanted to get off the bed.
Oh, this could be...
She was kind of pushing on, squatting on all fours, and I had to get down to just see what was going on, just in case the baby made an appearance while she was near the floor.
While a squatting position can be great for bringing on delivery, the baby is showing signs of distress.
Zosia, that's her heartbeat, okay? So it's kind of doing the same thing it was earlier, okay? Can we get you into the bed?
The woman and her partner, they want to do the best for their baby and the best for themselves. And sometimes I hope that they won't feel disappointed if it doesn't just turn out according to the plan, because we don't really know what's going to happen, no matter how well prepared we can be, and the woman and her partner, still things may not go to plan.
She's not there, so every time you push, she comes forward, then she slides back.
And when she was nearly at the point of delivery, the heartbeat was obviously, it wasn't recovering as quickly as it had been.
Sophia, at this stage we need to think of giving you a hand with the delivery, okay?
Kayla has called on the help of Dr. Namreen for a second opinion on delivery.
Baby's heart is good, but it's dipping down in between, okay? What do you think if we need to give you a hand with the delivery? You'll be okay? Just putting a cup on baby's head?
Just to pull her out of it, yeah.
You're so close, all right? You're so close.
You can do it yourself. I can wait 10 more minutes.
Okay, but you have to
Yeah, but you have to go hard.
almightily, okay? Yeah.
Come on.
Okay. Come on. Go for it. That's it. Come on. Come on. That's it. You're doing it.
She's on the way. She's on the way. Come on.
And another one. Come on.
Big one. Wow, she's on the way.
With pushing not going as well as hoped and signs of increasing baby distress, Zosia has opted for a small incision in the hope of avoiding an instrumental delivery.
Episiotomies are not nice. As a woman myself, the thought of one is just not nice.
Just some local anesthetic to numb the area, all right? You'll feel a sharp prick there.
Unfortunately, though, it can be the difference between a woman delivering a baby herself or needing an instrument to assist delivering the baby.
And again, right down
And
in
again,
the
a
bum.
smoke up there now.
That's it, you can do it, you can do it, you can do it. Keep it going, keep it going, keep it going. Excellent.
I didn't want the instruments. I was like, I'm gonna do it myself. I can do it.
Come on.
All the way back and right down
Come on.
into your bum.
Right
Come
down,
on,
down,
that's it,
down,
really
down, down,
well.
down. Yeah, the baby's almost out. Come on. Keep it going.
Keep it
Come on,
going.
big push.
Okay, big deep breath in.
Blow,
That's it,
blow,
blow,
blow, blow.
blow,
Good.
blow. That's it. And have a look.
Oh my God.
Oh my God, it's just the best feeling in the world. Like, it's beyond words. You can't describe it. It's like she's in your tummy and then she's on your chest and you have her. It's like, it's amazing.
Yeah, it was wonderful. Yeah, there's a nappy there. Now we have a baby to look after, and
Yeah, meeting her for the first time.
yeah, it's amazing. It's that long wait, I think, you know, like you're waiting 9 months and then she's suddenly with you.
Yeah, just meeting her for the first time and having her on my chest. It's amazing. I'm like, we actually have a daughter. She's ours. A little human.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out. Come on.
Events to be remembered and retold for generations to come.
Well done. You're okay. Your baby's nearly here. Oh, here we go.
Doing pelvic floor exercises, it's important to do it correctly. So when you do your pelvic floor exercise, it's an inside muscle. So you only squeeze the muscles inside. So nobody should know you're doing your pelvic floor exercises. You shouldn't be holding your breath. You shouldn't be going up and down on your buttocks. So you squeeze the muscle from around the back passage and bring that feeling forwards and upwards. Keep breathing and no one should know you're doing them.
Weights and... Does everyone know it's a boy? Yeah. Yeah? Yeah. Yeah. So guessing the weights now.
Checking into the Rotunda are 21-year-olds Jessica and Sean, who are expecting their first child. The intensity of the contractions has come as a surprise.
I would have liked to have thought like that I had like quite a high pain threshold, but it didn't turn out that way. Do you know what I mean? Like especially in a class, like give you all the breathing exercises, that just goes right out the window. Like it's the last thing in your mind. Come up.
Fantastic. You're okay. You're okay. All right. You're all right.
For pain relief, Jessica has chosen to have an epidural.
The pain was immense. Yeah, definitely so.
It's okay. It's okay. Big suck in and blow out.
My hand will never be the same.
That's what I said to him. I said, I'm surprised you didn't go running from me, like, do you know what I mean? Oh, well, that's it. Stay focused. Squeeze Sean's hand if you need to. Oh, I can't do it.
You can, Jessica. Jessica, you can. You're okay. Jessica. You're okay. Use your gas. Come on now, use your gas. That's it. In and out. Come on now.
It's very important as a midwife to support them and encourage them to stay still and breathe, like deep breathing techniques, whether it's natural breathing or using the gas and air.
Well done. Contraction? No. Pain in your back? Middle, left or right? Left? Pain in the left. You're okay.
Is it shock pain or?
Pressure on the left. Okay, really, really important to breathe on the gas. That wasn't easy, but you did so well. Well done.
Yeah, it wasn't easy.
I've 30 euros my account. That's what I have to my name. I'm 46 and I own 30 euro. I had to bring the animals to the vet yesterday evening and I was going to bring my own
There's
card.
your money. There's your money there.
That cost 80 quid. And that was just for the cat. The cat's mouth's gone green. Something's going on.
Have you pet insurance, Ruth?
No, I don't have health insurance for me. I'm hardly going to have health insurance for you.
It'll be unusual for you. But
in fairness,
like having the beacon.
We work in Tesco's, that's how we met. It's really weird though, like it started out as like proper mates and then he thought it'd be funny to buy me a bunch of flowers on Valentine's Day. Oh.
Jess had no Valentine. And I just thought it'd be nice to, or a bit funny to buy her some flowers and a box of chocolates and give them to her in front of the whole canteen, all the people. And ever since then, kind of just clicked.
Oh, how long ago was that? Last year. Oh, lovely. Because that's what's funny about it is that we were dating for a while and then like when you make it official, my pregnancy dates back to that time. No way. Yeah.
When we found out Jess was pregnant, it was a big shock, you know. You don't really know how to react. And then everything starts rushing through your mind, like, you know, well, where do we go from here? Who do we tell? Who do we not tell?
So the Valentine's this year will be completely different. There'll be flowers and a baby. Oh yeah. But you have to get flowers, so make that a ritual now every year. Flowers and roses as a little joke.
Yeah, we are snack box. Yeah, your snack box.
All I'm thinking of is cold toes. What is wrong with me?
There, your snack box.
Which day do you look like this?
I've seen all this.
If I woke up with no arms and legs, would you still love me?
Brazilian couple Alina and Tiago are expecting their second child together. It's been a rocky road to this point in their relationship.
Depois, por volta dos 22 anos, né, a gente se encontrou numa festa e ficou nesse dia. Aí, assim, começou a ficar e já ficou mais sério. Foi onde a gente começou a namorar. Aí, desse namoro, veio o Gabriel, nosso primeiro filho. Ele comprou a passagem para vir para Irlanda. Aí, ele veio sozinho, depois eu ia vir. Só que durante um ano que ele estava aqui, aí não deu certo o relacionamento assim, né, com a distância. E a gente voltou de novo, o Gabriel já estava com 9. Nesses 4 anos, a gente, assim, tinha relacionamento mesmo só de...
Amigo?
Amigos, assim, a gente não se envolveu, não. E nesse tempo, ele não teve uma fase muito boa no Brasil.
Me envolvi com droga, fui bem no fundo do poço mesmo, então eu cheguei até a me internar numa clínica de recuperação. E nesse período que eu me internei nessa clínica de recuperação foi onde a minha mãe e a minha irmã e a Aline, que me ajudaram bastante.
Alina has an appointment at the Rotunda's maternal medicine clinic.
So I'm just checking, Alina, that...
She's had a very precarious and difficult pregnancy so far. At 24 weeks, she was rushed into hospital.
Teve dia, eu acordei engasgada, fui no banheiro, tossi e saiu sangue. O Thiago me trouxe para o hospital, os exames, medicamento, tudo era de risco para o bebê. Foi colocando muito sangue para fora, aquele sangue vivo. Tá encaixado já?
It's not down, but it's in the right position. She had a background of abnormal development in her lungs, something called bronchiectasis. When she became pregnant, there's increased blood flow to the lungs. So this was an event that happened suddenly and could have absolutely put her life at risk.
O tempo todo eu só rezava, pedia a Deus. Não sei, eu tinha medo de perder minha esposa, eu tinha medo de perder minha filha, eu não sabia o que fazer. Como chefe de família, eu me senti frágil, eu me senti meio que inútil.
Blood pressure is excellent. It's normal, yeah.
Alina needed emergency surgery at a general hospital to correct the problem. Unfortunately, she suffered a stroke during the procedure and went temporarily blind.
Because that's important to keep an eye on your blood pressure, particularly because of what happened with your vision.
As pessoas, quando vê ela, perguntam, nossa, mas você teve um AVC? Ainda a gente fala, não, ainda continua, mas assim, ainda não acabou. Mas com fé em Deus vai dar tudo certo. Já tá dando certo e vai dar certo até o final. Né, irmão?
I'm not a Ghostbuster, I expect to do. Oh, Sarah, have you heard of Sarah? You heard of Sarah, have you? The doors open and closed and the baby's hat's been moved. And have you ever seen the old windows, the old draw windows, you know, they weigh half a ton. One of those shot up in the middle of the night when there was 2 midwives there having a cup of tea. And they bricked themselves, they were terrified.
No gas when there's no pain. Back in a moment.
Jessica has had the epidural for 3 hours, but it hasn't been fully effective.
The working job. I examined her. Like, she's very, it's pressure. Like, no, she's very distressed with pressure. Like, she was 6 centimetres an hour ago, only an hour and 5 minutes ago. She's contracting.
Where was the H when she was 6?
-1.
Sure, get her.
What's it?
Get her to the wife. Oh.
She's asking for you.
You're okay, honey, you're okay. You're okay. Jessica, use the gas, okay? You have to stay in control of the situation, okay? Really slow breaths in and out.
It was heartbreaking at moments, but you have to be calm and kind of persevere so she can be calm, because the last thing you want is for her to get stressed out, you know?
Well done, I'm sorry. Fantastic, okay, well done. Nice slow breaths in and out. So your baby's lying with his back to your back, okay? If you can imagine right now, he's lying like this. He's looking up to the sky, okay? The wider part of his head is trying to descend into the pelvis. But unfortunately, in this position, it's just gonna be really tough to get on top of the pain relief, okay? Keep using your gas. She was just so tired at this stage. She was exhausted, she was in so much pain, she was emotional. And, you know, she kept saying she wanted the baby to come out there and then. This Pat, is it? Sorry for disturbing you. Can you come and review a lady in room 9? She has an epidural site, but it's not working. The anaesthetist is senior.
I never thought it wouldn't work the first time. Like, you know, you don't think things don't work when you're in the hospital, but it just didn't
Stuff
work.
happens.
Yeah,
and
it didn't work, and that was kind of scary.
Well done. That's fantastic.
In less than 5% of cases, the epidural isn't fully effective.
It does happen. Epidurals don't always work, you know, and it can be very traumatic and stressful for the lady because the idea of an epidural is pain relief and pain-free. And when it doesn't go to plan then, you know, that can be very distressing.
Oh.
Well done, you're okay.
Hey, sorry.
You're doing great, love. You're doing great.
She got a second epidural. It's called a combined spinal epidural. So it's a little bit different. It's a spinal epidural with an epidural, so it works quicker. Is that okay? I'll go for some break, some lunch, okay? The pressure is normal, honey, okay? I've taken the gas away.
Pain is gone completely though. It's just pressure, I promise.
Super. And if the pain comes back, you know where the button is on the epidural. Okay, you're the best. Well done.
Thank you very much.
You're very welcome.
It's not easy.
You're doing great.
You won't want to come near me. Like she's a flippin' lunatic.
I knew that before sometimes.
Shut up.
Doing what? Told you.
That's it. You got to go to
It's time for Alina and Tiago to have their baby. Alina's medical history will impact on the form of delivery.
As Alina has had coughed up blood from a bleeding blood vessel in her lung, anything that might increase the pressure to that area would be worrying. And so therefore a long labour perhaps would put more strain on that area.
É, tem vezes que ela dói assim, só de lado, assim. Não sei se é onde tem coágulo.
Procurar não ficar nervosa nem estressar. Né?
Quando eu tô estressada, dá aquela pressão na cabeça. Faz tum. É tipo um coração batendo na cabeça.
The best advice is that she avoid having a prolonged labour, avoid pushing, and therefore we've recommended that the baby be born by cesarean section.
Maria passa na frente, Marcelo passa na frente. Dá tudo certo, São Miguel.
No parto do Gabriel, hoje o Gabriel está com 12 anos, ele não pôde estar presente. Aí esse agora que ele vai poder estar presente. E assim, é um momento muito importante para a vida do casal. Vou se sentir mais segura com ele do lado.
Okay, we have a little girl, okay? There you go, she's gorgeous, all right? Well done, okay?
Nasceu pretinho. Nasceu pretinho. Dedão.
Olha, nem de direito, não.
Isso é muito forte. Valeu, velho. Agora passou, né? Que alívio.
You okay to put it there, okay?
Nossa, que tamanhozinho.
There you go, gorgeous.
Papai, narizinho de papai.
Oh, reconhece a voz.
Sofia, que dentinho bonito, papai. Cara de papai.
Cortando as trompas. Mas só que por causa dos problemas, das complicações que eu tive, aí todas as minhas gravidez e parto vai ser de risco. Aí a gente optou, vai ficar só com
2 meses. Uma guerreira, já veio lutando junto com a gente. E é isso aí, a gente tem uma gratidão imensa a Deus. E começar tudo de novo, depois de 12 anos. Não é fácil não, mas a gente estamos aí, firme e forte.
Excuse me?
Yeah.
Para 5 centimetres.
However, you can come like slow walk up to room
So,
now.
Slow.
Preferably like 16 minutes slow.
16 minutes.
Fantastic. So Jessica, I can't feel any cervix. Okay. That means that you're 10 centimetres. Well done. So at 6:20, we'll start pushing to meet this baby, okay? It's funny.
It's fully dilated.
It's fully dilated.
Sean. 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 We're 10 centimetres.
Did you hear the good news, Sean?
I did not, no.
I told you, 10 centimetres.
I was asleep.
So we started pushing, I think it was either 6:30 or 7:30. No, it was 6:30.
No, 6:30 would have been.
Big deep breath in, chin on your chest, and a really strong push down. Push all that pressure away. Push your baby down, that's it. Stronger than that. Stronger than that. Keep going, keep going, keep going, keep going. Stronger. I think it was only every 1 in 3 pushes, I think I was actually getting something out of it, like where the baby was actually getting pushed down and stuff. Really strong. Keep going, keep going, keep going. Tried all different positions to push, like on the left side and the right side. Fantastic. Well done. Catch your breath. And it just got to that point where it was kind of going, okay, right, you were coming up on about a 45-minute mark. Nothing's really happening still. That's when I said to him, I said, like, I'm actually starting to get a bit worried now, like if there's something wrong.
I'm just going to check your temperature there. Just the baby's heart rate is getting a little bit high, and sometimes your temperature is 38, so it's quite high. Okay, so there's only so long we can leave you. If you're really hot, you can imagine that inside the baby's even hotter, and it's not a great environment for them to be in. And the heart rate is starting to get a little bit high, so I think that we give the doctors a shout, and they might give you a hand.
Yeah.
Is that okay?
That's perfect.
Chin on your chest and bear down all the way into your bottom. Really.
With the baby showing signs of distress, a doctor has arrived to attempt an instrumental delivery.
Keep going, keep going. The doctor downwards extracts the baby with the forceps. The mum has to still push the baby out and the doctor guides the baby. Okay, all right, that's it. Go for it. Big, big push, big, big push. Keep going, keep going, keep going, keep going, keep going. Well done, fantastic. That's it. Catch your breath. The contraction's gone.
I've heard about what the forceps are like and what they do, but
You don't expect.
geez, you don't expect it
It
because
was a new level. Go on, use it, use it, use it, use it, use it. Keep going, Jessica. Keep going, 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 keep going. Keep going, keep going, Jessica. Okay, I'm relaxed. I'm relaxed. I'm relaxed. Again, it was the same thing. Every 1 in 3 pushes, we were only getting something, even with the help.
After a failed forceps delivery, Jessica is being prepped for theatre.
Lift up your bum. You're pushing so long and you're coming down, they're looking up, okay? The only alternative was to deliver by C-section. And that was pretty stressful, and it was a category 1 section, so it's all hands on deck. You understand, okay? Because his heart rate is going high. There's slow breaths in and out, you're okay.
she gets whisked away, then that's when I think I lost my cool a little bit, and because I'm not really have any control anymore.
Now, will you get that changed?
Yep.
Thank you.
We use incubators in our neonatal intensive care units for several reasons. The incubator is obviously a very clear plastic box that allows us to see babies. So inside the incubator, in the first week or two, we'll often find that they're in 36-degree heat just to keep themselves warm. Their skin is so immature, they need to be in a lot of humidity. So these babies will be in 85–90% humidity. Their skin is so thin. You can see veins very clearly through the skin. It's just immature.
Downward dog. Is that what you're doing?
Yeah, I did a hiccup.
Oh. Is that because of air or something?
Parents of 4, Aileen and Rory, have been keeping vigil at the incubator of their premature daughter Emily since her delivery at 26 weeks gestation.
Little baby Emily was running into some problems before she was delivered. She was smaller than we would like and not growing terribly well. And although there are risks associated with being born prematurely, there are times when the balance of risks is in favour of bringing somebody out and bringing them to the NICU, delivering them early.
Good girl. Good girl.
No, she had 18 mils of
Air in her, I know.
That's what's the CPAP belly.
Yeah. Once they started, you know, the section and the baby was coming out, they did the delayed cord clamping and you could just hear somebody shouting out 10, 20, 30, and they got to 50 seconds, and then there was this tiny, tiny little squeak of, you know, I just remember looking at you going, that's our baby. You know, the baby is alive. She's sucking her thumb. Yeah, good girl. We had been told if we get baby out of the theatre and into the NICU, it'll be minute by minute. So our first hurdle was
firstly to get baby out.
Yeah.
To make sure baby's okay, and then get baby as far as the NICU, and they would take it from there, and they were going to call us when they had baby settled. So that was
her birth.
Emily was born more than 3 months before her due date and weighed just over 600 grams.
Some of my tears have been, you know, like at home, have been about, I should still be pregnant. I should be waddling around the place and saying, oh, you know, like, I'm tired. In a way, you do feel as if she was just taken away from me, and because you can't hold her, which is your just instinct as a mammy, is just to hold her and to try and, you know, make her feel better and soothe her and calm her, and I can't do what I should be doing. Oh, and now you start to wriggle again. You're wriggling. Yeah. Okay. That's okay. Don't forget to breathe. Oh, that's all right.
Premature baby can have two kinds of problems with breathing. The first one is that quite simply they forget to. The basic stimulus that comes from your brain telling you to breathe in and out is a little stop-start in babies. The second big group of breathing problems that premature babies have is because their lungs are immature. Emily was very tiny, but she was also just a little over a half of the way through pregnancy. Her lungs were not like the lungs of an older child, and they don't work as effectively or as efficiently.
I just tend to watch the monitor and just see it constantly, and the main one at the moment is her respiration, so it's the number of times she's breathing. If she forgets to breathe, then it brings everything down, so the heart rate, and she's actually done that now. She has. Up you go. Good girl. But you have to breathe, don't you? Now, somebody going to come over? Come on. Come on, Missy. Come on, you were doing so well there for a bit. Oh.
With Emily's oxygen saturation levels dropping fast, neonatal nurse Marilyn stimulates her to restart her breathing.
She's been up and down all day. Yeah. Oh.
Another factor making it hard for Emily to breathe is excess air in her tummy due to the CPAP breathing assistance machine. Marilyn eases this by using a syringe to suck some of the air out.
Oh. Good girl. Oh, look, you're gone pink again. Oh, that's better. That is much better. You know, they say that this is a roller coaster, and you know it's a roller coaster, and you know that there's going to be bad days and good days and really, really bad days, but you still, when they actually come, it just hits you like a ton of bricks, and you just think the worst, and you think they're going to find other things. They're going to, you know, is this potentially the end? You know, how can somebody so tiny, come out of it? And then you just see her, and she's rallying there, and she's a fighter, and she's determined, and she's doing fine. She's doing fine. Like, we would do anything for her, but We can't breathe for her.
Jessica is being prepared for an emergency cesarean section after a failed forceps delivery. After 10 hours by her side, Sean is waiting to be called into theatre for delivery.
That's sore there when you're pressing around it.
I can feel the sharpness.
Do you feel it sore or it's on the shot? Is that sore?
Yeah.
GA?
Yeah.
Don't be sorry.
Just tell Dad about that next.
Don't be sorry, honey, okay? But we need to make sure you're comfortable before we do the section, okay? Because you can't be in pain. So we are going to put you off to sleep, okay?
She's still feeling a little bit of sharpness, so they decided that it's best to put her to sleep for the section. Alright, that means you won't be able to go in, okay? And she's okay, everything's fine. It's just she wasn't really comfortable, so it's just better to put her to sleep. Alright. So when we've news, we'll be out to you.
Yeah.
Alright guys, knife to skin.
7:52.
Waiting outside the theatre, that was very scary. It was one of the scariest things I think I ever had to think, because you don't know what to be feeling. Like, I'm just sitting out there and just waiting for anything, you know. I kind of just had to kind of sit down and say, right, well, they know what they're doing, of course, like, you know, but it's very worrying. I remember just the first thing I heard then was him crying. And that was like the most relieving feeling of my life. Like, you hear nothing and then you just hear this little baby crying, you know he's all right. And then you can see him just through the cracks of the door and off stuff, you know, getting cleaned and everything. And it was great.
Sean, look who's here. Look at you. Congratulations. Well done. There you go. There's your little man. He's perfect. Look at the lips. It's beautiful. Well done. Well done. Have a seat there behind you, just with him. Just well done. Have a seat. He's absolutely perfect. He's really big. Yeah, he's really big, but he's perfect. There you go. Look, if you stop crying there, because you're holding him. Well done. He's perfect. Hey, buddy. How are you?
Yeah, I'd be browned off as well. Took your time, didn't you? Didn't you? Yeah. It was absolutely amazing, just that moment of fear, really, and then just for it to all be just washed away in a moment. You know, it was great.
Okay. Come on, mister. What's your name?
Rory.
Rory.
Rory, yeah.
Oh, lovely. Come on, Puddin.
Get a seat.
His birth, as traumatic as it was and how scary as it was, wouldn't change a second of it, because I don't think he would have came out the same. I mean, everything happens for a reason.
Oh my God.
Arriving into the delivery suite is Christina, originally from Lithuania, and her fiancé Raphael from Brazil. They are hoping to meet their first child today.
I'm looking at your notes here. Christina, I'm Anne, lovely to meet you. And Raphael.
I'm Raphael.
Raphael, lovely to meet you. So come on in.
Thank you.
She landed in 3 centimetres, looked very calm, asked her what she would like to do as regards pain relief, and she said she'd have just the gasp.
You're doing really well, and you're not even vocal. Like most people are quite upset at this stage.
Can't wait to meet him.
A boy, is it?
Oh. Most ladies will be quite distressed even at 1 centimetre. So she was very quiet.
Raphael,
yes.
Your spelling of your weightless is it here? Raphael. That's perfect. I think that was the spelling of one of the turtles, was it?
Yeah.
Yeah, because I was just thinking that was sort of popular when I was.
You're probably one of the few ones that came up with the turtles, because usually people remind of Caravaggio, the painter, Italian painter.
Oh yeah, that was the Middle Ages, wasn't it?
Yeah.
I'm not that old yet. So where did you meet?
New Year's. New Year's Eve.
Oh, very good.
I went on New Year's for to Lithuania.
Lovely.
I met there.
And you met herself.
Her. Yeah. As most people have been doing lately, using those apps to, matchmakers, things like that. And I used one of them, came across her profile, and then we started talking and said, okay, let's meet.
Oh, I better close the door. It's like being in O'Connell Street, isn't it?
Then I went over to her house, collect her with my friend. She just got into the car. She had never seen me before. I looked at her, you're crazy. Like, how come you come into a car with two guys you never met, going to a neighbor city? She looked at me, you are crazy. I'm in my country. I remember, you may not remember that, but she said, we speak Russian here. If I just shout here, you won't ever leave this country. And I got scared.
Because when I lie, it is stronger.
Oh, yeah, absolutely. Well, you can get back off the bed. It's good to keep mobile anyway, because it'll help to bring the baby's head down, okay? Well,
we kind of liked each other straight away, Don't know if it would be too much to say love at first sight, at least from my perspective. I really liked her. I came back home. I was like thinking about her and all of that. I said, well, I would like to meet her again. And then things just start flowing.
And you've had no stretch marks, you lucky thing.
We always planned our holidays to meet somewhere in different countries. And we met quite a few times.
Yeah.
Just as well you didn't get any bigger. I think the nightwear is just at the stretching point, isn't it?
After just 5 months of a whirlwind long-distance romance, Christina discovered she was pregnant.
Then I was like, wow, it was a very short story, unplanned pregnancy, but brilliant, like.
Would you like a stool to swivel on? You know, move a little bit with your hips like this in between? Feel that would help you a little bit? Because it just, you know the way you get a little bit of backache. It might just help you there a bit. Now, I need our stool. I am here for 31 years now. It's a long time. And I loved here. So did room 1 deliver?
Yeah. Oh, yeah, room 1.
Ah,
yeah.
That's great.
Room 1 in an SVD.
Oh, I'm delighted. She had a previous section, hadn't she? Oh, I'm delighted. What did I come out here for now? The babies are still arriving out the same way as they always did. I came out for something. Oh, the stool. Yeah, there we go. And it's dangerous going outside that door, do you know that? You go outside the door and you're asked about 20 things.
God. Yeah, bad, no? Look at that, so dry.
That's fine.
Cracked and bleeding.
The only place I need to moisturise is my
feet.
Tattoo.
Fuck, show us it.
Show
I only saw it in 2D. Oh my God, Annette, what were you thinking? Were you drunk?
Hilarious.
Yeah,
What did he forget? She got
did he forget one of those?
Yeah, at 4 o'clock in the evening, she says to me, on Friday, will you come in and get a tattoo with me? I'm afraid to go by myself. Would you want me to get one? And she goes, yeah. And I said, you said you were thinking about it. I said, no, I only said I was thinking about it. I said, but it has to be something that means something to me.
Yeah. That's a good one. That is deadly.
Where's the lovely ones down the middle of her back?
That's gas.
So funny.
So gas.
Are you ready for some cuddles?
Baby Emily is well enough to be held by her parents for the first time in more than a week. She has reached the milestone of 1 kilo in weight.
Hi, Lily. How are you? Hello. Hi. Hi. Yeah.
You know who's that?
Up you go. Up you go. You're definitely heavier since the last time you were here. You're getting bigger.
Are you happy? Who's more comfy, Daddy or Mommy?
Oh, don't ask that question.
It's funny to say she's getting big, and she has got big, but she has, and she's kind of padding out a bit, and...
She's 1.5 the size, 1.5 times bigger at this point,
Your milk will come out more.
I can feel it getting, they're tingly. Yeah, no, I definitely do. I feel as if there's a tingliness kind of right there straight away the second she comes on me.
It's extremely important for preemies to have colostrum and to have breast milk straight from
the mother. So I have been expressing since the recovery room. Your big brother was 4 kilos when he was born, so you have a long way to go to catch up with him. The other hand is over just there. It has the cannula in it, so I think it's heavy for her to move. She's had a sleepy day. She hasn't really been wiggling.
When she was very small, she'd put on 50 grams over a day. When she was going from like 650, 700, and I was kind of doing the maths on it, it's equivalent to me putting on 3 stone in 24 hours. So it's kind of like, because she had to change the breathing. It's like, yeah, you'd be very tired if you put on, an extra 3 stone onto your body.
No, come on.
Oh dear.
Up, up. Up you go, missus. Come on, up, up.
Good girl, you're going to do it, aren't you? You're going to do it. Oh, little lady. I don't think that you're ever out of the woods in the NICU. Anything could happen at any stage. Have you aired your chum? Oh, have you? You think you're doing okay, and I think
We're still day by day, and
we
it's
are
8 weeks later, so.
Look at that air.
Oh, yeah. Now,
I have her.
you have her, and I'll...
Yeah, hey.
No.
Did you enjoy it?
Hi, little lady. Hi, little lady. You get them out. It's great to get her out. I can feel my chest is all red from where she was. So, hold on to that for another little bit.
I remember the epidural only came in on my last baby. And you kept him for 2 weeks after your sections.
No, only 5 days. People died of like clots in their lungs and everything because they were immobilised, stuck in beds. Like you stayed in for nearly 7 days after vaginal delivery in those days as well, So now they're barely in 12 hours in a home.
If even some of them are gone after 6.
They've had to come in a few hours.
Still 3 centimetres dilated. Christina had been hoping for a quick labour.
Usually when you're at the 3 centimetres, Christina, it's normally about, you could say, up to 12 hours before you'd have the baby. But only nature will, God will know, okay? You might be one of those ones that will go quick enough. But usually we say 1 centimetre an hour is the way. So, I mean, you've 7 more to go, you had when you came up. It doesn't just drop out. Or like on the TV, on the TV it says, oh, the waters are gone. And then they say, oh, yes, give us a push. And you hear a big scream and out flies the baby. It doesn't happen like that on the first. Maybe on your 2nd or 3rd, if you're lucky. Not on the first, okay? You're doing great, Christina. Everyone's a little bit closer.
I don't feel like I'm doing great.
From the first contraction, it was very, very painful.
It just makes me dizzy. Doesn't help.
Don't take them.
I thought I can do naturally without any pain relief or anything. I don't know why I thought that.
Can I have a epidural?
You can, of course. You feel you want to go with that, do you? Okay. Okay, that's
I was hoping I won't need it, but I can't stand.
Yeah, you're very calm, I have to say. Oh yes, I had an epidural on my first baby, and that was 30 years ago. And I was delighted with it. It was great. Try to keep the head down as much as you can, honey, and relax down the shoulders. That's it. Just nice and relaxed. Good girl. Well, I have 8 children myself. I've had some in my 20s, some in my 30s, and some in my 40s. Girl, you're doing fabulous. So I do know what it's like.
Oh, having contraction.
Got a contraction?
Yeah.
Okay.
Yeah, we'll just wait for a moment.
Yeah, go ahead with your gas there, yeah. Okay.
She made us feel like home, although we were in the hospital, but you couldn't even feel that that feeling. Yeah, it's like having mom next to you.
oh my God, I'm alive again.
So you be aware of me, just feel my finger, okay?
After 2 hours in the delivery room, Anne is about to break Christina's waters. Something that doesn't faze Raphael.
You sure you want to watch this?
Yeah, I don't mind. I've seen worse, believe me. I've been nursing for about 15 years, and you develop this kind of feeling that you become very cold. You see everyone as a potential patient, even if it's your family.
You're doing well. You're 7 centimetres. So well done, well done. And the water is clear.
That's good, 7
Actually, you know,
centimeters.
like you've gone quite quickly. You know, it's great that you've gone so quickly. So I hope we'll see this baby before I go.
Give me a kiss. You're doing well.
Yeah, very well.
My delivery some years ago, which I believe is still the record for the heaviest baby at the Rotunda, which was about 6.5 kilos, which is about 14.5 pounds. I remember getting a card from them afterwards, thanking me and saying from the parents and the little giant.
For the next step in Emily's recovery, the team tried to take her off the CPAP machine. Unfortunately, she only lasted a couple of days before having to go back on it.
These little kids, breathing is like running a marathon for them. And what we really want them to do is not to use all their calories up on breathing. We need them to get bigger and stronger, because that's building muscles and lungs and everything else they need to do it for themselves. So because of that, we want to balance not pushing too hard, but giving a little bit of a sprint every so often.
To be honest, I'm just a little disappointed for her to, you know, that she's back on the CPAP. I knew it last night. It's just coming in this morning. Then it's just kind of like it's. I know you have to try and error, like it's all trial and error. See how she gets on, and I just felt that, you know, for her, because she did seem to be a bit more comfortable around the face and all of that. And
Initially, when you come off CPAP, you might kind of manage, but if you get a little tired, you just kind of lose a little ground all the time, and sometimes a couple of days on CPAP just gets you back to where you started. And in the meantime, she's growing her muscles, she's doing those nice push-ups that'll help her breathing, and she's doing all the other stuff as well. We can't say she's going to do it the next time, but if that doesn't work, she'll go back on CPAP for another 2 or 3 days, and then we'll try to, and one of these times she'll just take off. You know, she really will. Yeah. I didn't pass my driving test the first time around. You know, got there. I'm a very good driver now. She'll do the same.
Hello, labour ward Ruth.
After just 5 hours in the delivery room, it's time for Christina to start pushing, and for these first-time parents to meet their new baby.
That's the girl. Big, strong push. Keep it coming, that's it. Bit more if you can, a little bit more.
Because of epidural, and had to tell me when to push.
Well done. Well done. That was excellent. Yeah.
That's a hard job.
Brilliant. And again, fill up again. Big push down again.
Well, I tried as hard as I can.
Oh my goodness, keep going with that push. That's really good, Christina.
You have to keep pushing for long period.
Well done, honey. Keep it going.
I try to keep pushing until the end says enough.
Yeah, your baby's head is coming, okay? Well done.
Oh.
Well done, honey. Well done. That's it. Give us another push there.
Go, go,
Good
go, go.
girl. Another push. Come on, another push. He's crying before he's even out. I'll just take the cords around his neck, so I'll just take that away. There we go. Now, congratulations. Isn't he just lovely? 343. God bless you. Now. Oh, he's like his daddy.
I just looked at the baby and said, wow, I'm a daddy now. I have a family.
Up onto mommy there. There we are. Now. Oh, congratulations to you both. Well done. Well done.
Thank you very much.
Oh, he's so lovely, isn't he? It's a miracle every time, and I think if it ever comes a time when you don't feel it's a miracle or you lose the awe in birth, I think it's time to maybe move on at that stage.
Yeah, he looks like that.
He's so lovely.
Yeah, Mom and Dad is here, don't cry.
Coitadinha. Mandando beijo pra mim.
I first think I thought he's a little copy of Rafa.
Yeah.
You recognize Daddy's voice.
Mandando beijo pra mim. Yeah. I don't believe in coincidence. I think people just come across each other for a reason, for a purpose.
Put them against your skin there like that. That's perfect.
I believe we're not here for free. There's a reason for us to be here, for a reason to be together. And now we have something in common to keep ourselves walking together.
A gente vai cortar as unhas grandes?